June is Pride Month, a time to lift up and celebrate the LGBTQ+ community. It's important to foster safe spaces in all areas of life, and that includes the doctor's office. That's why Valley Medical Group has opened a care center in New Jersey specifically tailored to the community. Joining me now is the medical director of Valley Center for LGBTQ+ Care in Paramus, Dr. Ralph Bernardo, and the assistant vice president of quality and performance improvement for Valley Health System, Josh Gregoire. Sorry. So welcome.
Thank you, Cindy.
It's so nice to have you both here. And I love talking about this because it just opened in March, so it's brand new. All right, so Ralph, what are the major health concerns for, that really affect the LGBTQ+ community?
Yeah, Cindy, I think this is a very important question. Unfortunately, the LGBTQ+ community continues to face significant healthcare disparities. And this includes things like limited access to safe, affirming, and comprehensive care. The community sees increased rates of certain medical conditions like cardiovascular disease, as well as things like depression, suicide, substance use. There are also increased rates of certain cancers and sexually transmitted infections.
And Josh, how can patients or family members, ensure that they receive appropriate care?
Absolutely. One great option is the Healthcare Equality Index designation from the Human Rights Campaign, which helps to identify providers who have committed to providing inclusive care. Websites such as the LGBTQ Healthcare Directory or local government sites can actually be a great resource. Word of mouth from people within the LGBTQ community is invaluable. And doing your research, reading reviews, and even bringing along a supportive friend or family member to a visit can be a great option.
And Ralph, what are the questions, should an LGBTQ+ person ask their provider before they even say, hey, you're going to be my person?
Absolutely. I think that's also an important question. I think members of the community should feel comfortable asking their providers about their experience working with the LGBTQ+ community. It's also important to ask about their approach to providing preventative services that are particularly tailored to the unique needs of the community. And finally, I think it's important to ask about your provider's comfort level, talking about things that sometimes can be little bit more sensitive, like talking about your sexual health, your gender identity, sexual orientation, or even your mental health well-being.
And Ralph, what if an individual is looking to start a family?
I think that this is such an important question. I think healthcare providers need to be a resource for patients in all aspects of their healthcare, including family planning. And I think these conversations are so important and often overlooked. Yeah. I think we need to remember that individuals within the LGBTQ+ community can have the same reproductive desires as anyone else. And yes, these conversations can sometimes be difficult to have. And I can tell you from personal experience, when my husband and I went through the process many years ago, we had so many questions. Now, depending on an individual's circumstances, this could include things like adoption, assisted reproductive technologies, like in vitro fertilization, or surrogacy. Either way, I think these conversations are important to have with your provider. Ask about the appropriate referrals and even ask about available community resources.
And Josh, what's an important takeaway for viewers watching today during Pride Month?
Sure. So our call to action is twofold. For healthcare providers, it's about creating inclusive spaces for culturally competent care. And for everybody, it's about advocating for LGBTQ health. And it's about remembering that people are on health journeys and we need to support them to be their authentic selves.
Thank you so much for being here and for all the work you both are doing.
Thank you, Cindy. Thanks for having us.
And have a wonderful Father's Day to both of you.
Thank you so much.